Next, we're going to be moving on to the mouth and pharynx assessment. And I'm looking at the lips. They're symmetrical, intact, dry, pink. I'm going to have you, I'm just going to feel your lips here. No tenderness, swelling, or any lesions. I'm going to have you open your mouth for me. Mucosa is moist and pink. And then I'm going to just palpate inside the mouth for any lesions. Gums are pink, intact, and the soft palate. Good. This time I'd wash my hands and gloves. And then we're going to test cranial nerves 9 and 10. I'm going to have you open your mouth, and I'm going to have you say, ah, ah. The cranial nerves 9 and 10 were intact. Uvula and soft palate rised, as she stated, ah. And then I'm going to have you open one more time for me. The pharynx looks a little red, but pink, intact. And then, Melanie, I'm going to have you stick out your tongue and move it side to side. Perfect. We just tested cranial nerve 12, and that it was intact as well. And then I'm also going to have you smile for me, and then frown. Perfect. That's testing cranial nerves 5 and 7. And then next we are going to go over the neck and lymph nodes. So I'm going to feel the preauricular lymph node, postcellular, occipital, anterior cervical, post-cervical, sublingual, mandibular, and submental. Any tenderness at all?
No.
Good. I'm going to also have you move the jaw open and shut. Good. Any pain with that movement?
No.
I'm going to have you push against my chin, against my hand while you open your mouth. Good. And then have your mouth open. And then try and close. Good. Muscle strength was intact. This time I'm going to have you shrug your shoulders. And then you're going to do this against my resistance. Good. That was cranial nerve number 11. And that was intact. I'm also going to feel your trachea here for any lumps or bumps. Trachea is midline. Now I'm going to feel your thyroid as you swallow. So I'm just going to displace it a little bit and swallow for me. Good. And then one more time. Good. And then next, I'm just going to listen to your lungs from the back. And I'm just going to lift up your shirt. Lung sounds are clear. I heard more bronchovesicular in the upper part of the lungs and more of the vesicular in the base of the lungs. I'm also going to take a listen to the trachea as well. And the trachea has more of the bronchial noises. And then we are going to percuss on the back and also do thoracic expansion. So I'm going to put my hands, sorry they're a little cold, on the back of your back, and I'm going to have you breathe in and exhale. Good. Thoracic expansion was good. Expanded my hands. Then I'm just going to compare your lateral chest to your anterior, posterior. And that was a ratio of 1 to 2, which is normal. Now I'm going to percuss the back of your lungs. And I heard Renaissance more on the top here and dullness to about here. And then same on the other side, the resonance on the left side until about here where the dullness started to come out there. And I am also going to do the feel for any crepitus, any popping or cracking feels on the top here. I'm not feeling any of that. I'm also going to have you say 99 while I listen to, or while I feel your back.
99.
And again.
99.
And again.
99.
And again.
99.
Good. And the vibrations decreased as I got more towards the base of the lungs versus the top. Okay. And now I'm going to have you lay down for me, Melanie, as we move to the cardiovascular system. So the chest is symmetrical. Skin tone is even throughout, trachea midline. I'm going to look for any jugular vein distension. And I don't see any of that, but I do see some palpations from the carotid artery. And then I'm also going to look for any chest lifts and palpitations as well. I'm going to listen to the aortic, pulmonic, tricuspid, mitral, and the herbs point. I'm just going to lift up your shirt here. No adventurous sounds. S1 and S2 was heard. No murmurs and no S3 or S4. I'm going to look for the maximum apex lift here in the apical. And I'm going to see if I see any aortic palpitations on the stomach here. And I do see that a little bit here. During the cardiovascular exam, I'm also going to look at skin color. It's even throughout, no cyanosis or pallor at all. Skin turgor is less than 3 seconds. Capillary refill is less than 3 seconds as well, normal. I'm also going to feel for the temporal, carotid, brachial, radial, femoral, posttibial, and dorsal pedis pulses as well. So I'm going to feel for your temporal pulses here. Good. You feel the carotid. I'm going to grade these 0 to 3, 2 being moderate and normal. These have all been 2s. Both the brachial were 2s. Radial. It's a 2. And then I'm going to do the femoral. Those were a 2. And I'm going to have you lift your leg for the popliteal. That was a 2. And then I'm going to have you lift the other leg. It's a 2. And I'm just going to take off your socks. The posttibial. And the dorsal pedis. Dorsal pedis were a little weak. Skin turgor is 3 seconds. And smooth capillary refill on the toes. There is some varicose veins on this left lower leg and some petechiae on the left foot. Skin is a little dry. Then I'm also going to listen with the bell for any bruits in those main arteries there. Also going to listen for any abnormal sounds with the bell over the renal artery, the aortic, femoral arteries. I'm also going to listen to the temporal with the bell to see if there's any bruits. No abnormal sounds with that. Next, we're going to move on to the abdomen. I'm going to examine. I notice that the stomach is round, symmetrical, that the skin is even throughout, umbilicus is midline and introverted. You're going to listen for vowel sounds in all quadrants. Vowel sounds are active and audible. Next, I'm going to palpate for any tenderness, any lumps, bumps, and any rebound tenderness with deep palpation. First, I'm going to start with light palpation. Tell me if you feel any tenderness. No inflammation, any mass or lumps felt. Then we're going to go more towards deep palpation, see for any rebound tenderness. Good. And then we are going to percuss over the stomach. And we hear mainly timpani over the stomach.